We are right in the middle of flu season, even though you might not think about it these days. There haven't been many cases of it during this COVID-19 pandemic. KAMC's Claudia Puente joins us now with a look at what the flu season is looking like.
COVID has been a lot to keep up with for everyone this season, but it seems like the flu was pretty unheard of this year. We're already well into February and past the Omicron peak. So what happened to the flu?
Flu season started in October, and with the Omicron peak, many are left wondering what exactly happened.
We're seeing some flu cases, but not. It's not like one of the years where we're really concerned about flu.
Credit for the lack of flu cases can surprisingly be given to COVID and the pandemic.
A lot of the safety precautions or public health prevention actually helps reduce the transmission of flu.
While it might make us want to let our guard down, the flu still has chances of peaking in March and April.
If you're sick, a lot of the testing right now actually can differentiate. With one swab, they can test for multiple things.
Not only have flu cases gone down, but the Lubbock Health Department has now been seeing 40 to 50 COVID cases a day, a huge difference from approximately 500 cases a day that they had during the surge.
If our case count gets down to like 5 or 10 a day, I would really say we're not seeing community spread anymore. Yesterday, I think they tested 18. So that need for testing has also decreased. There's not as many people sick that want to go out and get tested.
The Public Health Department still urges individuals to get vaccinated, wear masks, and follow CDC guidelines to keep seeing these declines.
The most important thing is to stay home if you're sick. Regardless if it's COVID or flu, you don't want to be spreading that around to others in our community.
The health department is providing testing that can detect if you either have COVID or the flu. For more information on where you can find testing locations, head to everythinglubbock.com.